Binge eating disorder. It is characterized by recurrent episodes of consuming large amounts of food, often quickly, and to the point of discomfort. Amnesia. Amnesia refers to partial or complete memory loss, often triggered by trauma or psychological distress. Bruxism. It is the grinding or clenching of teeth, often occurring during sleep and leading to dental issues and jaw pain. Dissociative fugue. Dissociative fugue involves sudden, unexpected travel away from home, often with an inability to recall one's past and personal identity. Folie deux. It is a rare condition protected by the transfer of a delusional picture from one patient to another, linked to the first by a close relationship. Body dysmorphic disorder. Individuals with this disorder are excessively preoccupied with perceived flaws or defects in their physical appearance. Acute stress disorder. Acute stress disorder is also known as ASD. It is a psychological response to a shocking or traumatic event. Pica. Pica involves the persistent eating of non-nutritive, non-food substances and is inappropriate for the individual's developmental level. Adjustment disorders. Adjustment disorders occur when an individual has difficulty coping with a stressful life event. Delusional disorder. The affected person has wrong and unreal beliefs that persist over time. Agoraphobia. Agoraphobia is a condition in which a person has an intense fear of places or situations where it may be difficult to escape or ask for help if needed. Alcohol and substance abuse. Involves the harmful use of substances like alcohol or drugs. Encopresis. It refers to regular and uncontrolled defecation in clothes or other inappropriate places in a person over 4 years of age. Exhibitionism. Exhibitionism involves a recurrent and intense sexual urge to expose one's genitals to others, typically strangers. Antisocial personality disorder. ASPD, also known as sociopathy, involves a pervasive pattern of disregard for the rights of others, impulsivity, deceitfulness, and lack of remorse. Kleptomania. Kleptomania is characterized by the recurrent failure to resist impulses to steal items that are not needed for personal use or monetary gain. Attention Deficit Hyperactivity Disorder. Also known as ADHD, it is a neurodevelopmental disorder characterized by persistent patterns of inattention, hyperactivity, and impulsivity. Dermotillomania. Also known as skin picking disorder, it involves recurrent and compulsive picking at one's own skin leading to tissue damage. Autism. Autism is a neurodevelopmental disorder marked by challenges in social interaction, communication, and repetitive behaviors. It exists on a spectrum, with varying degrees of severity. Avoidant personality disorder. People with avoidant personality disorder exhibit a pervasive pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation, leading to avoidance of social interactions. Bibliomania. It is an obsessive-compulsive disorder for collecting and possessing books, often to the detriment of other aspects of life. Anorexia. It is an eating disorder characterized by an intense fear of gaining weight, leading to self-imposed hunger and a distorted body image. Bipolar disorder. Bipolar disorder or manic depression is a mental condition that leads to alternating episodes of mania and depression. Borderline personality disorder. BPD is characterized by instability in mood, self-image, and interpersonal relationships. Brief psychotic disorder. A short-term psychotic episode marked by delusions, hallucinations, and disorganized thinking. Primary hypersomnia. Primary hypersomnia involves excessive daytime sleepiness without a clear cause, leading to prolonged and unrefreshing sleep. Bulimia. It involves recurrent episodes of overeating, followed by compensatory behaviors like vomiting, fasting, or excessive exercise to prevent weight gain. Conduct disorder. It is a childhood or adolescent disorder characterized by persistent patterns of behavior that violate societal norms and the rights of others, such as aggression, destruction, or deceit. Conversion disorder. Conversion disorder involves neurological symptoms such as paralysis or blindness that cannot be explained by a medical condition. They are thought to be linked to psychological factors. Dependent personality disorder. Individuals with dependent personality disorder exhibit a pervasive need to be taken care of and fear of separation. General adaptation syndrome. It refers to the body's response to stress involving 3 stages: alarm, resistance, and exhaustion. Depressive personality disorder. It is a condition where individuals often feel sad, lonely, inadequate, and guilty. They react strongly to loss or rejection, experiencing intense feelings of emptiness and inadequacy. Dissocial personality disorder. It is marked by a pervasive disregard for the rights of others, lack of empathy, deceitfulness, and a history of conduct problems. Dissociative identity disorder. Formerly known as DID or multiple personality disorder, it involves the presence of 2 or more distinct identities or personality states, each with its own way of interacting with the world. Expressive language disorder. It is a lifelong condition that impacts the ability to use language. People with this language disorder understand what others are saying, but they have a hard time expressing their own ideas when they speak. Gender identity disorder. Gender identity disorder, now known as gender dysphoria, involves a marked incongruence between one's assigned gender at birth and their experienced or expressed gender identity. Depersonalization disorder. Depersonalization disorder involves persistent or recurrent experiences of feeling detached from one's own mental processes or body, often described as an out-of-body experience. Down syndrome. Down syndrome is a genetic disorder in which a person has an extra copy of a chromosome called chromosome 21. This extra chromosome causes many health problems. Dyslexia. It is the difficulty in reading and writing correctly and fluently. Enuresis, also called bedwetting, is the repeated inability to control urination beyond the age when voluntary bladder control should have been achieved. Erotomania. Erotomania is a type of delusional disorder in which the patient has an unfounded and obsessive belief that another person has romantic feelings towards him. Generalized anxiety disorder. GAD is characterized by excessive and uncontrollable worry about various aspects of life, often accompanied by physical symptoms such as muscle tension and restlessness. Histrionic personality disorder. Histrionic personality disorder is characterized by a pattern of attention-seeking behavior, excessive emotionality, and a need for approval. Hypochondriasis. Hypochondriasis, now known as illness anxiety disorder, involves excessive worry about having a serious medical condition, despite minimal or no evidence of illness. Onychophagia. Onychophagia is the compulsive habit of biting one's nails, often leading to tissue damage and infection. Sleepwalking disorder. Sleepwalking disorder involves engaging in complex behaviors while still in a state of partial arousal from sleep, often with no memory of the event. Mathematics disorder. Mathematics disorder is characterized by difficulties in learning and performing mathematical skills, despite adequate intelligence and educational opportunities. Nightmare disorder. Nightmare disorder involves recurrent nightmares that cause significant distress or impairment in daily functioning. Primary insomnia. Primary insomnia involves difficulties in initiating or maintaining sleep, not attributable to another medical or psychological condition. Trichotillomania. Trichotillomania is characterized by the recurrent pulling out of one's own hair, leading to hair loss and significant distress. Joubert syndrome. Joubert syndrome is a rare genetic disorder characterized by the underdevelopment of the cerebellar vermis, leading to neurological and developmental abnormalities. Schizophrenia. Schizophrenia is a severe mental disorder characterized by disturbances in thought, perception, and behavior, often leading to impaired daily functioning. Social anxiety disorder. It is a mental disorder in which individuals experience fear when interacting with others. Hysteria. Hysteria is when someone has a very strong emotion that is unmanageable. Rumination syndrome. Rumination syndrome involves the repeated regurgitation of food, which is then either re-chewed, re-swallowed, or spit out, unrelated to a medical condition. Alcohol and substance dependence. A more severe form of abuse, dependence is marked by physiological and psychological reliance on substances, with difficulty controlling use and experiencing withdrawal symptoms. Munchausen syndrome. Munchausen syndrome involves the fabrication or exaggeration of physical or psychological symptoms for the purpose of assuming the sick role. If you like this format, check out this video. YouTube thinks that you'll like it.